My name is Ashley Jackson. I'm here to discuss weight management in pregnancy. My PICO question is, do pregnant women who set goals aimed at prevention of excess weight gain as opposed to those who do not set goals have greater success at prevention of excess gestational weight gain? This is an important topic to discuss because obesity is a growing epidemic in the United States in not only the pregnant population but the pregnant population as well. Several studies have shown that an increased weight gain while pregnant leads to several adverse effects such as preeclampsia, gestational diabetes, stillbirth, neural tube defects, abnormal fetal growth, cesarean delivery, and obesity for the child later in life. The Institute of Medicine has established guidelines for gestational weight gain. Patients who are considered underweight with a BMI of less than 18.5 should gain 28 to 40 pounds during pregnancy. Those who are considered normal weight with a BMI of 18.5 to 24.9 should gain 25 to 35 pounds. Overweight women with a BMI of 25 to 29.9 should gain 15 to 25 pounds, and obese women with a BMI greater than 30 should gain 11 to 20 pounds. There were 4 types of studies used in 5 of the articles: 2 qualitative, a cross-sectional prospective cohort with historical controls, and a randomized control trial. One of the researchers took 21 hours of observation until data saturation had been reached. This study looked to see if pregnant women who received the intervention of education with handouts and counseling would overall gain less weight than the control group. And there was another study where open-ended responses were used to stimulate discussion. The session lasted for approximately an hour. They were audio taped and then transcribed verbatim. The key phrases were then coded into transcripts just to see if patients understood the adverse effects that obesity during pregnancy has on not only the mother but also the fetus. So the overall synthesis is that patients that had a higher BMI prior to pregnancy also had an increased weight gain. Some of this can be contributed to a lack of education because patients just don't know the adverse effects that are associated with obesity during pregnancy. So an intervention that can be aimed to decrease weight gain during pregnancy is just education and handout materials. Many inexpensive ways were shown in these studies to be successful. One particular research group did their study on low-income women who were uninsured. They were provided educational materials, and they actually had very positive results. They had not only a decreased weight gain during their pregnancy, but they also had a decreased weight retention at their 6-week postpartum visit. Another study divided participants into 3 groups. Group 1 was underweight and normal weight patients. Group 2 were overweight patients, and Group 3 were obese patients. Then after this stratification, they were randomly assigned to either the control group, who received prenatal care the rest of the pregnancy, or the intervention group, who received lifestyle counseling and dietary counseling. These patients also had a decreased weight gain during their pregnancy, as well as the decreased weight retention at their 6-week postpartum. So a lot of this just leads to the fact that the patients are uneducated. They just don't understand the adverse effects that are associated with obesity during pregnancy. A lot of this can be done at just a primary care family practice, because a lot of these patients use their primary care provider as the only prenatal care that they see. Primary care providers are the only doctors or nurse practitioners that these patients are in contact with. So just something as simple as handouts that are inexpensive to the healthcare provider can have just such a tremendous effect on the mother and the fetus. So that is my presentation. Thank you.